Welcome back, Dr. Cass. I'd like to talk to you about your book, Supplement Your Prescription. I have two questions for you. Today, we have incidents where there are children 6 months old that are being given two prescription drugs that were tested on men, never tested for interactions. What would you do if you were a parent, or even if you were a doctor? What would you recommend?
Running as fast as you can. I think that this giving drugs to babies is outrageous. Now, if there are times when it's appropriate. If a child has an infection, you would give an antibiotic. That's fine. But there's so many drugs that haven't been tested. And I have children coming into my office. I'm a psychiatrist. I have young children coming into my office on a whole slew of drugs, being diagnosed bipolar, being diagnosed ADD, when in fact what's really so is that these children are eating very poorly and they are nutrient deficient. They don't have the right nutrients in their body to function properly, and their blood sugar is out of balance. They don't have enough B vitamins. All of these would be remedied if they'd eat whole foods and take a multivitamin, rather than they're being given all of these medications which have not been tested. We have no idea what the long-term effects are of a lot of these psychotropic medications. When I say psychotropic, I mean medications that affect the brain, and I don't think we can risk our children's brains the way we're doing it.
So basically, it's not don't drug instead of supplement necessarily in some instances, right? I mean,
yeah, and I think the pediatricians really have to get on board here. They really need to educate themselves, and I do as much as I can to educate physicians. Pediatricians have to learn how to supplement, how to dose supplements for children, to be very cautious about prescribing medications to very young children, and to only use them appropriately and in very low doses. And by the way, even adults are being overdosed.
That's what I wanted to ask you about. If you go into the average nursing home, I understand that you'll find out, and not necessarily just nursing home, adults over 65, particularly men, are on 5 prescriptions on average. Doesn't that really compound the situation radically?
Very often it does, and some of these drugs that they're on actually do deplete their vitamins and minerals and make them actually worse. If you take certain prescription drugs that deplete your B vitamins, you can look a lot like you have Alzheimer's, and then when you replete, you give the B vitamins back in and some other antioxidants, some vitamin C and E, basically a high potency multivitamin. You're going to see a really very good improvement, especially if you give the vitamin B12 in the under the tongue or sublingual form, because elderly people may have problems absorbing it through the usual means, and they have to take it sublingually under the tongue so it goes directly into the system.
Dr. Cass, I really believe that Supplement Your Prescription is a book that would be vital for anyone to have in their medical library, whether it's someone who is raising a baby, or is carrying a baby, or whether it's someone who is in their older years. It's something that we really all need to be educated on. Thank you.
You're welcome.